Okay, beta. See, now rectus sheath is the question. So rectus sheath, as you said, Ritika, like it is formed by the aponeurosis of three muscles of abdomen, isn't it? What are the three muscles you said? External oblique, internal oblique, and transversus abdominis. Okay. Now the formation of rectus sheath differs. Now see, this is the extent from the xiphoid process till the pubic symphysis. Till this whole line is the rectus sheath. Inside the rectus sheath, you will find, see, this green line is rectus sheath. This green line is also rectus sheath. That means in the upper part, it is not present behind. Posteriorly, it is deficient. Again, in the lower part, again, green line is not there. That means it is deficient behind. Okay. So inside the rectus sheath, you are finding a muscle. As you said, it is rectus abdominis. Now, let us see the extent. Now, above the costal margin, that means this one beta. See, these are the costal margins, 1, 2, 3. So, above the costal margin, anterior wall is contributed by, see, aponeurosis of external oblique abdominis. Posteriorly, there is no sheath, no aponeurosis. Directly, the muscle is resting on 5th, 6th, and 7th costal cartilages. Okay, from the ribs. Okay, now see, like you see here, between the costal margin and arcuate line, this is the arcuate line, but this line, the contribution of rectus sheath anteriorly is external oblique aponeurosis and the anterior lamina of the internal oblique aponeurosis. Posteriorly, it is formed by posterior lamina of internal oblique and the aponeurosis of transversus abdominis. Now, below this line, below the arcuate line, anteriorly all the three flat muscles aponeurosis is taking part. External, internal, and transversus aponeurosis will form the anterior wall of rectus sheath. Posteriorly, as you have seen here, it is deficient. Below arcuate line, it is directly resting on fascia transversalis. Okay. Now coming to the composition of rectus sheath, what does it contain? It contains the rectus abdominis and also the superior epigastric artery and inferior epigastric artery and their anastomosis. We also find certain nerves. Okay. So what are the various nerves we will find, beta? The thoraco-abdominal nerves also we will see inside the rectus sheath. Okay. See, as you said, we also find pyramidalis. Then the corresponding veins like superior and inferior epigastric vein. Okay. Then superior epigastric artery is a branch of which artery, beta? It's a terminal branch of internal thoracic artery. Okay. Inferior epigastric artery is a branch of the internal iliac artery. Now, nerves, which nerves do we have? Lower 6 thoracic nerves, including the lower 5 intercostal nerves and subcostal nerves. Okay, 16.21 is the diagram showing nerves. Okay, it's not so good, but still you can see the thoracic nerves, how they are entering and supplying the rectus sheath. Okay.
Okay.
So we will do inversion eversion.
Yes, ma'am.
Beta. See, inversion and eversion. If you keep your foot in such a way like your sole is facing towards midline, that is inversion. And if you turn your foot in such a way like your sole is facing outwards, you call it as eversion. So inversion is brought about by tibialis anterior and posterior. Eversion is brought about by peroneus longus and peroneus brevis. Okay, beta? So this also has been put in that paragraph form. Just read once, you will definitely understand. Okay?
Okay.
53, it has been given. What is the next question we have? Microscopic trachea, testis, chromosomes, eversion, rectus sheath, blood supply of lungs. What are the derivatives of septum transversum? Diaphragm and liver, beta. Okay? diaphragm,
Oh,
and liver. Okay, transparent. What is metaphysis, beta? It is from general anatomy. When you just look at long bone, the upper end is
mm,
epiphysis, lower end is epiphysis, middle end is
it is
diaphysis. The general
diaphysis.
point of diaphysis and epiphysis is metaphysis. Okay,
Huh.
the point of union
Yes.
of epiphysis and diaphysis is metaphysis. Okay, the importance is at this point you will have like coiled blood vessels which are called as metaphyseal arteries. Hairpin bend, it is like a spring like coil bends, you will see the blood vessels will be like. So the clinical aspect of this is, suppose if there is any bacteria or something, because of the coiling of blood vessels like a spring, the bacteria gets trapped over there causing damage to the growing bone. Okay, that's why metaphysis
Okay.
is here. Okay, so I think we are done with all questions. Beta. Okay,
Okay.
okay, beta. We'll stop here then.
Huh, ma'am.